What if the symptom you keep brushing off is not random? A swollen belly, bone pain. A child who suddenly acts off. Let me be clear, most symptoms are not cancer. But ignoring a pattern can cost time you do not get back. This is not another video telling you every stomachache is a disaster. That kind of content is cheap fear. Here's the truth. Pediatric neuroblastoma is rare, but it can look ordinary at first. That is what makes it dangerous. It does not always enter the room with flashing lights. Sometimes it looks like constipation, fatigue, a limp, poor appetite, a kid who stops playing like themselves, and because parents are told not to overact, many wait. They Google, they compare, they hope it passes. Nobody tells you this. The question is not, is this definitely cancer? The better question is this pattern normal for my child? That question can change everything. Imagine this. A 4-year-old starts eating less. Nothing dramatic, just less. Then their belly looks a little rounder. Family says, maybe gas. A few nights later they wake up crying about leg pain. The next week they limp after playing. One symptom. Easy to dismiss. Two symptoms. Still confusing. Several symptoms that keep coming back. That is the alarm, and no, this does not mean parents should panic every time a child gets tired. Kids get tired. Kids get stomach bugs. Kids limp after playground chaos. But here is where brutal honesty matters. If a child's body keeps whispering the same warning in different ways, pretending not to hear it is not calm. It is risky. A parent's job is not to diagnose neuroblastoma. A parent's job is to notice when the story stops making sense. Pediatric neuroblastoma is a cancer that starts in immature nerve cells called neuroblasts. These cells are part of the sympathetic nervous system, which helps control automatic body functions like heart rate, digestion, blood pressure, and stress response. It often starts near the adrenal glands, which sit above the kidneys. But it can also appear in the neck, chest, abdomen, or near the spine. That is why symptoms can look scattered. Belly swelling, constipation. Coughing, trouble breathing. Bone pain, limping. Weakness, unusual bruising around the eyes. Weight loss, fatigue. It is not one neat symptom. It is often a messy medical puzzle. And that is the problem. Parents are waiting for one obvious sign. But the body may be giving a pattern instead. Neuroblastoma happens when immature nerve cells grow in an uncontrolled way instead of developing normally. Let me be clear, in most cases, this is not because a parent fed the wrong food, missed a supplement, allowed too much sugar, or made one bad decision. Health content online loves blame. It sells well, but blame is not medicine. Most families do not get a clean reason why this happened. A small number of cases may involve inherited genetic factors, but many do not. So if you are a parent listening to this, hear this carefully. Guilt will not help your child. Observation will. Documentation will. Medical evaluation will. The goal is not to spiral. The goal is to act when symptoms persist, worsen, or combine. Stop looking for one perfect symptom. That is how serious things get missed. A belly lump by itself may be one clue. Bone pain may be another. A limp may be another. Loss of appetite may be another. The danger is when everyone treats each clue as separate. Here's the truth. Doctors need the whole timeline. Not just today's symptom. The story: when did it start? Did it go away? Did it come back? Is the child eating, sleeping, walking, peeing, pooping, and playing normally? If the answer is not really, do not minimize it. Write it down, bring it in. Here is the practical checklist first. Track the pattern, not for months, not obsessively. Just clearly date symptoms. Changes photos if there is swelling or bruising. Second, watch function. Can the child walk normally? Play normally, sleep normally, eat normally. Use the bathroom normally. Function matters because it shows whether symptoms are affecting real life. Third, no urgent signs. Seek urgent care if a child has trouble breathing, sudden weakness, trouble walking, severe pain, repeated vomiting, extreme sleepiness, loss of bladder or bowel control, or a rapidly growing lump. Fourth, ask direct questions. Say these symptoms are persisting and stacking together. What should we rule out? That sentence is powerful. It tells the clinician you are not chasing panic. You are asking for reasoning. Doctors may use physical exams, imaging tests, like ultrasound, Connecticut, or MRI, urine tests, blood tests, biopsy, and sometimes bone marrow testing to investigate neuroblastoma. You do not need to demand every test. You need to clearly describe the pattern so the doctor can choose the right next step. That is how you move from fear to information. Now, here is the part people usually do not want to hear. Some neuroblastomas behave differently from others. One child may need careful observation or surgery. Another may need chemotherapy, radiation, stem cell rescue, immunotherapy, or targeted treatment. Same disease name, different risk, different biology, different plan. So if you are comparing your child's case to a stranger's story online, stop. That is not research. That is emotional roulette. The medical team needs risk classification. That is what guides treatment intensity. Reality check. Health anxiety is real, but so is medical delay. Both can hurt families. Panic makes you see danger everywhere. Denial makes you explain danger away. Neither one is useful. The middle path is calm urgency. If symptoms are mild, short-lived, and improving, they may be nothing serious. But if symptoms persist, worsen, combine, or change how a child functions, get medical advice. And please do not replace evaluation with online hacks. No detox, no blood sugar trick. No immune boosting routine, no supplement stack. Those things cannot diagnose a tumor. They cannot stage cancer. They cannot tell whether a child needs treatment. Let me be clear, lifestyle matters for general health. But it is not a substitute for pediatric oncology evaluation, when warning signs are real. If something feels wrong, do not argue with your instincts for weeks. Use them. Call, ask, document, follow up. Here is the hopeful part. Not every scary symptom is neuroblastoma, and not every neuroblastoma story is the same. Pediatric cancer care is built around teams, risk groups, imaging, pathology, genetics, and treatment plans designed for the child in front of them. Hope is not pretending everything is fine. Hope is getting accurate information. Hope is asking better questions. Hope is not letting guilt drive the car. Hope is knowing that parents do not have to be medical experts to be powerful advocates. If your child is being evaluated, bring notes, bring questions, bring another adult if possible. Ask what symptoms require urgent attention. Ask who to call after hours. Ask what each test is trying to answer. You are not being difficult. You are building a map in the dark. And sometimes that map is exactly what a family needs. This video is for education only. It does not diagnose, treat, or replace advice from your child's doctor or pediatric oncology team. If your child has severe pain, trouble breathing, sudden weakness, trouble walking, loss of bladder or bowel control, extreme sleepiness, or a rapidly growing lump, seek urgent medical care. If this video helped you understand pediatric neuroblastoma without panic and without sugarcoating, subscribe for more clear medical education. Leave a comment with your questions or suggestions. Your question might help another parent catch a pattern sooner. And watch the next video, because we will break down childhood cancer warning signs that are often mistaken for normal kid problems.